Today, we're comparing probiotics and prebiotics head-to-head to determine which gut health strategy better protects your kidneys. Not supplement industry marketing, not generic gut health claims. Specific advantages for reducing uremic toxins, supporting kidney function, and protecting against kidney disease progression. The outcomes that actually matter for renal health. Both claim to support health throughout your body. But which approach actually provides better kidney protection through the gut-kidney axis? Right now, the score stands 0-0, but by the end of this video, you'll know the final score and the truth. This is the health verdict, where nature gets tested. Round 1. Mechanisms of action and the gut-kidney axis. Probiotics are live beneficial bacteria that you consume through supplements or fermented foods. When you take probiotics, you introduce strains like Lactobacillus and Bifidobacterium into your digestive tract. These bacteria colonize your gut temporarily. Most don't permanently establish themselves but provide benefits while present. Probiotics work by competing with harmful bacteria, producing beneficial compounds, modulating immune function, and maintaining gut barrier integrity. For kidney health specifically, certain probiotic strains reduce the production of uremic toxins. Waste products that damage kidneys struggle to eliminate. Studies show probiotics can lower blood levels of urea, creatinine, and other toxins that accumulate in chronic kidney disease. Prebiotics are non-digestible fibers that feed your existing beneficial gut bacteria. You consume prebiotics through foods like onions, garlic, bananas, and whole grains, or through supplements containing inulin, FOS or GOS. Prebiotics don't introduce new bacteria. They nourish and strengthen the beneficial microbes already living in your gut. This approach stimulates growth and activity of your native good bacteria, which then produce short-chain fatty acids and other beneficial metabolites. For kidney health, prebiotics reduce gut production of uremic toxins by shifting bacterial metabolism away from protein fermentation toward fiber fermentation. This decreases the burden on struggling kidneys. Both approaches support kidney health through gut optimization but via different mechanisms, introduction versus nourishment. This foundational round establishes how each works without declaring a winner yet. Current score: probiotics 0, prebiotics 0. Round 2. Reduction of uremic toxins. Probiotics demonstrate significant uremic toxin reduction in chronic kidney disease patients. Studies show that specific probiotic strains reduce blood levels of p-cresyl sulfate and indoxyl sulfate, dangerous uremic toxins produced by gut bacteria that kidneys normally eliminate. In chronic kidney disease patients, these toxins accumulate and cause cardiovascular damage, inflammation, and accelerated kidney function decline. Research indicates that probiotic supplementation can reduce these toxin levels by 20 to 30%. Probiotics work by reducing the gut bacteria that produce these toxins and by consuming nitrogen compounds that would otherwise become uremic waste. Multiple clinical trials in chronic kidney disease patients show reduced blood urea nitrogen and improved uremic symptom management with probiotic therapy. Prebiotics also reduce uremic toxin production, but through different pathways. By feeding beneficial bacteria and promoting fiber fermentation over protein putrefaction, prebiotics shift gut bacterial metabolism in kidney-friendly directions. Studies show that prebiotic supplementation reduces blood urea levels and decreases the production of protein-derived uremic toxins. The short-chain fatty acids produced when bacteria ferment prebiotics have anti-inflammatory effects that protect kidney function. Research demonstrates that prebiotics reduce gut permeability, leaky gut, which prevents uremic toxins from entering the bloodstream. Some studies suggest prebiotics may provide more sustained toxin reduction because they strengthen your existing microbiome rather than introducing temporary bacterial colonies. Both approaches effectively reduce uremic toxins, but probiotics have more extensive research specifically in chronic kidney disease populations showing measurable blood level reductions. Probiotics take this round for stronger clinical evidence. The winner of this round is probiotics. Current score: probiotics 1, prebiotics 0. Round 3. Slowing chronic kidney disease progression. Probiotics show promise for slowing chronic kidney disease progression, but with modest effects. Studies in chronic kidney disease patients taking probiotics for 3 to 6 months show small improvements in estimated glomerular filtration rate, GFR, the primary measure of kidney function. The improvements are typically subtle, GFR increases of 2 to 5 points, but statistically significant. Probiotics reduce inflammation markers including C-reactive protein and inflammatory cytokines that drive kidney damage. They improve gut barrier function, preventing bacterial toxins from entering circulation and stressing kidneys. However, probiotics require ongoing supplementation. Benefits disappear when you stop taking them. The evidence for long-term disease modification is limited, with most studies lasting only months rather than years. Prebiotics demonstrate more sustained effects on kidney health because they strengthen your existing microbiome rather than providing temporary bacterial reinforcements. Research shows that prebiotic supplementation improves kidney function markers and slows eGFR decline in chronic kidney disease patients. The mechanism involves reducing systemic inflammation, decreasing oxidative stress, and improving metabolic health, all factors that protect kidney function. Prebiotics support the production of short-chain fatty acids that have nephroprotective properties. Some studies suggest prebiotics provide cumulative benefits. Your microbiome continues improving with sustained prebiotic intake, potentially offering better long-term kidney protection than probiotics' transient effects. Prebiotics' sustained microbiome strengthening and evidence for longer-term kidney function preservation give them the edge for slowing disease progression. The winner of this round is prebiotics. Current score, tied, 1-1. Round 4. Ease of use and dietary sources. Probiotics require intentional supplementation or consumption of specific fermented foods. Quality probiotic supplements cost $15 to $40 monthly and must be taken consistently, typically 1 to 2 capsules daily. They require refrigeration to maintain bacterial viability in many cases. Probiotic-rich foods include yogurt, kefir, kimchi, sauerkraut, and kombucha, but you need substantial portions regularly to match supplement doses. Most people find daily supplementation easier than consuming adequate fermented foods. However, probiotics can cause digestive discomfort initially, bloating, gas, changes in bowel habits as your gut adjusts. Some people never tolerate certain probiotic strains well. Prebiotics are remarkably accessible through whole foods most people already eat. Onions, garlic, leeks, asparagus, bananas, oats, barley, apples, and whole grains all provide prebiotics. Increasing these foods naturally boosts prebiotic intake without supplements. Prebiotic supplements, typically inulin or FOS powders, are inexpensive, $5 to $15 monthly, and easily mixed into foods or beverages. Prebiotics don't require refrigeration. However, rapidly increasing prebiotic intake causes significant gas and bloating for most people. The fiber fermentation that benefits your microbiome produces gas as a byproduct. Most people need to increase prebiotics gradually to minimize digestive discomfort. Prebiotics availability in common whole foods and lower cost give them an accessibility advantage, though both can cause digestive side effects during adjustment periods. The winner of this round is prebiotics. Current score, prebiotics 2, probiotics 1. Round 5. Scientific evidence in kidney disease. Probiotics have substantial clinical research in chronic kidney disease populations. Multiple randomized controlled trials specifically test probiotics in chronic kidney disease patients. Stages 3 through 5, measuring kidney function markers, uremic toxin levels, and quality of life. Studies consistently show probiotics reduce uremic toxins and improve certain kidney health markers. Meta-analyses confirm modest but real benefits. However, results vary significantly by probiotic strain. Not all probiotics provide kidney benefits. The most extensively studied strains for chronic kidney disease include certain lactobacillus and bifidobacterium species. Dosing matters. Studies typically use 10 billion to 100 billion CFU daily. The evidence base is solid but shows modest, rather than dramatic effects. Prebiotics have growing but less extensive research, specifically in kidney disease populations. Studies demonstrate that prebiotic supplementation improves kidney function markers and reduces inflammation in chronic kidney disease patients. The evidence shows prebiotics reduce uremic toxin production and slow disease progression. However, fewer large-scale trials exist compared to probiotics. Much prebiotic research examines general gut health benefits rather than kidney-specific outcomes. The kidney-focused studies that exist are promising but smaller and shorter term than the probiotic research base. Meta-analyses on prebiotics for kidney disease are limited by fewer available trials. Probiotics' more extensive research base, specifically in kidney disease populations, gives them the advantage for evidence strength despite both showing benefits. The winner of this round is probiotics. Current score, tied 2-2. Round 6. Safety and side effects. Probiotics are generally safe for most people, but carry specific risks for immunocompromised individuals. People with severely weakened immune systems, advanced kidney disease combined with immunosuppression, can develop serious infections from probiotic bacteria entering the bloodstream. Chronic kidney disease patients on immunosuppressive medications after kidney transplant should avoid probiotics or use only under medical supervision. Probiotics commonly cause temporary digestive discomfort, gas, bloating, diarrhea, especially when starting or with high doses. Some strains interact with medications or affect nutrient absorption. Quality control concerns exist. Many probiotic supplements don't contain the strains or quantities claimed on labels. For most chronic kidney disease patients not on immunosuppression, probiotics are safe when used appropriately. Prebiotics have an excellent safety profile with minimal risks. The primary side effects are digestive, gas, bloating, abdominal discomfort from fiber fermentation. These effects are temporary and diminish as your gut adjusts. Prebiotics don't carry infection risks like probiotics because you're not introducing live bacteria. People with small intestinal bacterial overgrowth, SIBO, may experience worsened symptoms from prebiotics, though this is uncommon. Prebiotics can affect nutrient absorption at very high doses, but typical dietary and supplement amounts are safe. For chronic kidney disease patients at any stage, prebiotics present minimal safety concerns. The lack of bacterial infection risk makes prebiotics universally safer than probiotics. Prebiotics' superior safety profile without bacterial infection concerns gives them a clear advantage, especially for vulnerable chronic kidney disease populations. The winner of this round is prebiotics. Current score, prebiotics 3, probiotics 2. Round 7. Long-term sustainability and cost. Probiotics require ongoing purchases and consistent supplementation to maintain benefits. When you stop taking probiotics, the introduced bacteria gradually disappear from your gut, and benefits diminish within weeks. This creates perpetual dependence on supplementation. Quality probiotics cost $200 to $500 annually. Some people maintain probiotic intake through fermented foods, reducing costs but requiring dietary commitment. The need for refrigeration complicates travel and storage. Long-term probiotic supplementation is sustainable financially for most people, but requires permanent lifestyle integration. The temporary nature of benefits means you never finish probiotic therapy. It's an ongoing intervention. Prebiotics build sustainable improvements to your native microbiome that persist even when supplementation decreases. By strengthening your existing beneficial bacteria, prebiotics create lasting microbiome changes. You can reduce or eliminate prebiotic supplements once your gut bacteria populations are well established, maintaining benefits through occasional prebiotic-rich foods. Prebiotic supplements cost $60 to $180 annually, substantially less than probiotics. Whole food sources like onions, garlic, and oats cost nothing extra if incorporated into regular diet. The permanent microbiome improvements prebiotics create offer better long-term value than probiotics' temporary effects. Many people successfully use prebiotics as a time-limited intervention rather than permanent supplementation. Prebiotics' ability to create lasting microbiome improvements at lower cost with potential for eventual supplement reduction gives them decisive long-term advantages. The winner of this round is prebiotics. Current score, prebiotics 4, probiotics 2. Final verdict. The final score is 4-2. Prebiotics win for kidney health through gut optimization. Probiotics provide legitimate kidney benefits, reducing uremic toxins, lowering inflammation, and supporting kidney function in chronic kidney disease patients. The clinical evidence specifically in kidney disease populations is more extensive than for prebiotics. Probiotics deliver measurable, immediate effects on uremic toxin levels. For people seeking rapid intervention or those with very advanced kidney disease, where every intervention matters, probiotics offer proven benefits backed by substantial research. But prebiotics provide superior overall value for kidney health. They strengthen your native microbiome sustainably rather than providing temporary bacterial reinforcements. The improvements prebiotics create persist beyond supplementation periods. Prebiotics cost less, are accessible through common foods, carry minimal safety risks, and support long-term kidney protection through lasting microbiome optimization. The approach is more physiologically sound. nourishing your existing bacteria rather than repeatedly introducing foreign strains. Here's the optimal strategy. Use both synergistically. Start with prebiotics as your foundation. Incorporate prebiotic-rich foods daily and consider inulin or FOS supplementation. This builds a strong, diverse microbiome. Add probiotics during high-need periods, active kidney disease progression, after antibiotic courses that devastate gut bacteria, or during acute uremic symptom flares. This combination provides prebiotics sustainable microbiome strengthening with probiotics immediate therapeutic effects when needed. For people with healthy kidneys seeking prevention, prebiotics through whole foods provide excellent kidney protection without supplements. For chronic kidney disease patients, prebiotics offer the best long-term value with optional probiotic addition during high-need periods. The gut-kidney axis is real and powerful. Optimize your gut health to protect your kidneys. This is the Health Verdict, where nature gets tested. Stay curious, stay healthy.